Hello everyone. So this is the third course and that's on the clinical audit. We are also running two more courses. The first one is on the cross-sectional and the case control and the cohort study design. And the second one is on the CDC Wonder Analysis database. And now we are launching the third one and that is on the clinical audit. Clinical audit is a very, very, very important skill for your CV because it shows that you are not only a doctor, you are someone who not only goes to the hospital and checks the patient, it is someone who is a little bit curious that whenever goes to the hospital, he observes that are the guidelines being followed, are the practices relevant, and he then suggests changes. Okay. So it's a very important person, and when you have this thing in your CV, you are a person who is good um, for health administration or even the healthcare setups, and even as a researcher and as a doctor because you care about the patients. So let's start this. What are the benefits of clinical audit? This is more or less a thing of, you can say, a theoretical perspective. It enhances patient safety, improves the clinical outcome. What it does, it promotes evidence-based practice. It fulfills the professional requirements and encourages team engagement and accountability. In other words, you can say what you are doing is you are checking, is the hospital following the guidelines or not? Because if the hospital is not following the guidelines, of course, patients' outcomes are being compromised. The guidelines that has been internationally set up, the hospital should follow them. Let me tell you a little bit about myself before we move on. I'm Dr. Sumaya Fatma from Pakistan. I have been running my mentorship program for around a year and more. I started it in April 2024, and around 900 plus students have registered with us. Okay, you can even check out my website on Google. Let me make you guys go through that. Okay. So you can even check it out. And it is on. Currently, the students are enrolled in different programs, like they are on cross-sectional study designs, CDC Wonder Analysis, clinical audits, and I'm currently working as a clinical research recruiter at Clinical Trial Network in Texas, Houston. Okay, one thing I can let you know for as a tip is when I was on the lookout for research positions across US and UK, one thing that stood out to me was that they are on the lookout for a person who has experience in more different research designs, study designs, okay? So instead of if two persons apply for the same post, that one person has around 50 research publication, and the other person has around just you can say seven. But that 50 publications are on the same study design, like they are of systematic review and meta-analysis. He has done 50 systematic reviews and got them published. He is not important to them as compared to the person who has seven study designs, seven researches published, but they are on different research design. He has done audit, he has a published cross-sectional studies, he has published systematic review, he has published narrative review, has a published letter to editor. That person will stand out. Okay, so I will ask you guys to learn any skills you want. Okay, learn about the CDC Wonder, learn the clinical audit, learn the different study designs as you go along the way. And when you will have published researches, you will present them, you will get invited as a speaker. These are three different differences between research, quality improvement, and clinical audit. What is the research? Research is a little bit extensive process. It takes months and sometimes even years to write a research and get it published. It's systematic data collection. You have to get ethical approval for that, and it's a little bit difficult process. The second one is a QIP. That is a quality improvement project. What is a QIP? That is, if I'm working in a hospital and I suggest to my HOD, my head of department, one thing, one idea, that I say, uh, excuse me, sir, I have an idea in mind, and that is if we hold weekly mortality meetings, our patient outcome will improve. This is just an idea in my mind, okay? And I have suggested to them. What it will require of me is the HOD will be like, okay, yeah, we can go with that. Okay. And he will implement this thing that we will have a mortality meeting on Friday to see what is leading to the deaths of the patient. Okay. Every month, I have to collect data to prove that the mortality meetings are contributing and beneficial for the outcome of the patient. So this is one thing that is a little bit of an extensive process. You have to establish an idea, collect data every month, then every month, then every month, and then you have to prove it that it is proving it in the right direction. Or even you can suggest any other idea, any other different process, like the people, everyone should wash their hand before touching the patient, or any other thing like that. So that it improves the healthcare process, and it's a very important project, but it is a little bit extensive and a little difficult to do. It can take 2 months and weeks, okay? And there are also, you have to get the ethical letter. Now we are concerned with the clinical audit. That is the main focus of our session. And that is the clinical audit is about what we have to do is we have to establish, we will not say we will have to establish, we will take up the international guidelines from WHO, from American Heart Association, from any other where, from NICE guidelines or any other international guidelines that have already been set up. And what we will see is our hospital following those guidelines or not? Okay, this is easy. You will just go and collect the data. One example I can give you is we did a clinical audit about the NICU band, neonatal ICU band, or any neonatal band that is tied to the baby. And there is a special guidelines about it, that where is the band tied on the right arm, right foot, or anywhere else, and what is written on the band. So we just went, we took those guidelines, we made a Google form out of it, we went to our neonatal wards and we checked, are the guidelines being followed or not? There were 50 babies in one ward. We collected the data of the 50 patients, and then we checked the data, we analyzed the data, and then we did an intervention. That's the whole process. Okay. So it was very easy for us. So it was very easy for us to get a clinical audit done. Okay. It is a very short duration. You can collect data in 2 days, 3 days, in a week, and you sometimes don't even need an ethical approval if you are concerned with only the documents. Like there was one of our my colleague, he did a clinical audit on the documentation thing, like how many people are documenting properly, how many postgraduate residents are documenting properly on the notes of the patients. So of course, it's not concerning the patient, so you don't need that proper ethical approval for that and stuff like that. I will give you some of the examples also along the way. So what is clinical audit? It's a review of practices against the standard guidelines. You take guidelines, you match them. That's it. You identify the area of improvement, ensure best practices are followed. This is the cycle of clinical audit. Okay, so let me stop the recording here.